Encouraging news tonight for the more than 50% of Americans who are fully vaccinated now. A new CNN analysis of CDC data suggests that 99.99% of fully vaccinated Americans have not had a breakthrough case severe enough to land them in the hospital or resulting in death. And it comes as we are learning even more about how the vaccine protects people from the worst of COVID. Joining me now to discuss is Dr. Alberto Shao. He is a radiologist at the University of California, San Diego Health, and has been analyzing X-rays of COVID patients since this pandemic began. Good evening to you. I'm so excited to talk to you, and I want people to be able to visually see what you're talking about. Thank you, thank you, thank you, Dr. Shao. So look, I want you to look at some of these pictures that you've got to show us just how much protection these vaccines give people. So we're looking at two sets of lungs from COVID-19 positive patients. The person on the left is vaccinated. The person on the right is not. So tell us what the pictures show you or show us about how effective the vaccines are.
Yeah, well, thanks for having me. I think the two images that you have are fairly representative of what we're seeing at UC San Diego and a number of other places around the country, I'm sure. The image on the left, I assume, is the patient who was previously vaccinated and had a very mild case of COVID for which there was very little involvement of the lungs. And the picture on the right is a picture of a patient who was previously not vaccinated, didn't get around to having the vaccine, and has a lot of white spaces, cloudy areas of the lungs that are indicative of pneumonia.
Yeah, wow. Can you explain, please, doctor, what the vaccine does to the body's immune system to create these results?
Well, so the vaccine gives your body a head start to see to react to a virus, to a foreign invader, well in advance of when that infection occurs. And so it's like having an army prepared before an attack. And so in the vaccinated patient, that army is already ready. Maybe it has to adjust a little bit, and it can quickly respond. In the unvaccinated patient, that's not the case. The foreign invader is completely catches the body by surprise and then allows it to grow unchecked.
Like I said, that you have been analyzing these X-rays since the beginning of the pandemic. Can you please tell us, can you tell us if the different variants can you see different variants in different images when you're looking at this?
Well, not directly. You know, honestly, once the vaccination rates hit the highs of locally, we've been able to get 70% of our local population vaccinated. We returned mostly to normal, and so what we're seeing now is a steep rise amongst mostly unvaccinated patients. A few vaccinated patients are getting COVID as well, but we're attributing that to the massive rise of Delta variant cases that we're experiencing.
With some of the breakthrough cases coming through, there's also been misinformation coming through as well. People saying that the vaccines don't help against the Delta variant. Do pictures like these need to get out to more people so that they can see that the point of all this is to prevent serious illness and death? I mean, that's really the bottom line here.
Right. I mean, I think over the coming years, this virus seems like it's going to be with us for a long time. We should be expecting that it will change and adapt to our immune responses, and eventually more and more people will get the infection. But the key thing for most of these infections, like the flu and whatnot, is if your body's prepared, then you won't get so sick and require a breathing tube.
Dr. Shao, thank you. I learned a lot. I really appreciate you being on tonight.
Yeah, thanks a lot for having me.
All right. So we're way past warning signs. 200 scientists now say global warming can't be stopped. And the consequences already being felt are only the beginning if we don't do something now. So stay with us.